bodybuilding athletes underestimate during prep is how compromised the immune system can become. Hi everyone, I'm Marietta. Welcome back to Bodybuilding Chart Notes. Today's chart note is a continuation on the conversation around common versus normal prep symptoms. This time with a bit more of a focus on immune and respiratory health during prep. Subjective. As I've said, prep places a significant amount of stress on the body. Again, calories are low, recovery capacity is reduced, stress hormones are elevated, and as a result, athletes are often more susceptible to getting sick. Objective. One thing I've noticed clinically, also personally, is that people will often tend to get sick in ways that they're already predisposed to. So for example, for me, I tend to get more of those like upper respiratory infections or like the colds. Whereas for someone else and patients that I've worked with, it may look more like recurrent bronchitis or sinus infections or digestive infections that kind of look like food poisoning. And honestly, major bodybuilding events can become the perfect storm for viral exposure. So we're talking about big expos like the Arnold or Pittsburgh or Olympia. They're bringing together huge numbers of athletes, spectators. There's travel, stress, there's lack of sleep, and then of course that exposure to an entirely new viral ecosystem. I also commonly see people getting sick immediately post-show, and part of that likely is because once food intake increases and activity decreases, your body now finally has enough resources available to actually mount that stronger immune response to something that has likely already been brewing underneath the surface for a while. So, because of that, I do think you can be proactive during prep, and that it can actually be a really important piece for some athletes. Personally, I like to do like a lower dose immune support product, more on a preventative aspect, something like Deep Immune by St. Francis Herb Farm. So again, not necessarily a mega dose, but more looking at supporting the body more consistently through periods of like high stress and under recovery. That said, getting sick once during prep may be relatively common. But I don't think it's normal for people to be getting sick like every 2-3 weeks, or for infections to be lasting like 4 to 6 weeks or longer. To me, that's often a sign that the body is really, really struggling with like an under recovery, burnout, insufficient resources type of thing. So when we're taking a look at some of these kind of more extreme cases, yeah, sometimes antibiotics are going to be absolutely necessary. But we have to acknowledge that they can disrupt the gut microbiome significantly. Untreated infections, though, can really become serious very quickly in an already stressed body, so they may be unavoidable. But this is why digestive recovery support during and after antibiotics can be really important. Assessment. I think bodybuilding culture sometimes underestimates how immunocompromised athletes can become during prep. And while an occasional illness may happen, recurrent or chronic illness is usually a sign that something needs deeper attention. Plan. So moving forward, I'll continue to prioritize proactive immune support during my preps, pay attention to early signs of illness and looking out for under recovery. And of course, as always, communicating symptoms openly and honestly with my coach, Kayleen, and any kind of healthcare practitioners on my team. Support recovery aggressively if an infection does happen to occur. Because for me, the goal isn't just to like survive prep. It's to maintain enough health and resilience to recover properly afterward. Closing reflection. Getting sick during prep may be common, but constantly being sick is something that we should not be normalizing. That's today's chart note. I'll see you in the next one.